Assalamu alaikum viewers, how are you all? I am Dr. Asif and today I am going to talk about vitamin D. So let's start. Vitamin D is a fat-soluble vitamin. It resembles sterols in structure and functions like a hormone. What are sterols? So sterols are basically a subgroups of steroids which occurs naturally in most eukaryotes including plants, animals and fungi, and it can also be produced by some bacteria. The most familiar type of animal sterol is cholesterol. Vitamin D was isolated by Angus in 1931, who named it calciferol. Vitamin D is regarded as a sunshine vitamin. So why it is named as sunshine vitamin? Because vitamin D is produced by the body in response to sun exposure, right? So our own body is able to produce vitamin D when our body is exposed to sunlight. So now coming towards how our body synthesizes vitamin D. So ergocalciferol, which is vitamin D2, is formed from ergosterol and is present in plants. Cholecalciferol, which is vitamin D3, is found in animals. On exposure to sunlight, the UV rays converts 7-dehydrocholesterol to cholecalciferol, which is basically vitamin D3 in our skin. The synthesis of vitamin D3 in the skin is proportional to the exposure to the sunlight. So it means that regular sun exposure is the most natural way to get enough vitamin D. Now coming towards absorption, transport and storage of vitamin D. So vitamin D is absorbed in the small intestine for which bile is essential. Through lymph, vitamin D enters the circulation bound to plasma alpha 2 globulin and is distributed through the body. Liver and other tissues store small amount of vitamin D. Biochemical functions of vitamin D. Calcitriol is the biologically active form of vitamin D. It regulates the plasma level of calcium and phosphate. Calcitriol mainly acts at three different levels: intestine, kidney, and bone. So, calcitriol is basically the active form of vitamin D, which is mainly found in the kidney, right? So it has three actions on three different levels, like intestine, kidney, and bone. Now we will discuss it one by one. Action of calcitriol on intestine. Calcitriol increases the intestinal absorption of calcium and phosphate. Action of calcitriol on the bone. In the osteoblasts of bone, calcitriol stimulates calcium uptake for deposition as calcium phosphate. Thus, calcitriol is essential for bone formation. The bone is an important reservoir of calcium and phosphate. Calcitriol, along with parathyroid hormone, increases the mobilization of calcium and phosphate from the bone and thus causes elevation of calcium and phosphate level in the plasma. So it means that vitamin D is very necessary for stronger bones and muscles. And without vitamin D, our bodies cannot effectively absorb calcium, which is essential to good bone health. Now coming towards action of calcitriol on kidneys. So calcitriol is also involved in minimizing the excretion of calcium and phosphate through the kidney by decreasing their excretion and enhancing reabsorption. Sources of vitamin D. So, what are the sources of vitamin D? So, the first one is sunlight. As we discussed earlier, this sunlight is very, very essential for vitamin D, and it is a good source of vitamin D. When the UV rays hit the skin surface, it changes the 7-dehydrocholesterol in our skin to cholecalciferol vitamin D3. Right? The second source of vitamin D is mushrooms. The third source is fish. Similarly, eggs are also a good source. Cod liver oil, it is also a good source of vitamin D. Yogurt, cheese, orange juice. So these are some sources of vitamin D from where we can fulfill our vitamin D deficiency. So now coming towards deficiency of vitamin D. Deficiency of vitamin D causes rickets in children and osteomalacia in adults. What is rickets? It is characterized by bone deformities due to incomplete mineralization, resulting in soft and pliable bones and delay in teeth formation. Because of deficiency of vitamin D3, our bones becomes very soft, porous, and it can easily be broken. Recommended dietary allowance. The daily requirement of vitamin D is 400 international units of cholecalciferol, and in countries with good sunlight like India, the RDA for vitamin D is 400 international units. Now coming towards dosage forms of vitamin D3. So it is available in the form of soft gel capsule, oral drops, injections. This is one of the brand Sunny D State, which is available in Pakistan. The adult dose is once in a month or use it with doctor recommendation. Second, it is Sunflex D drops, right? Which contains vitamin D3, 400 international units. Each 0.05 ml drop contains vitamin D3, 400 international units. So here the dose for children above 1 month to 4 years, 1 drop daily, above 4 years, 2 drops daily, and similarly for adults, start from 2 drops daily, and depending upon the patient condition, you can increase the dose. This is another dosage form, DL injection. So it contains cholecalciferol, 2 lakhs international units or 5 milligram per ml. It can be used orally or IM, intramuscularly. Dose of DL injection in infants receiving vitamin enriched milk, 1 lakh international units every 6 months, and in infants not receiving vitamin D enriched milk or young children up to 5 years, use 2 lakhs international units every 6 months. In adolescents, 2 lakh international units every 6 months during winter. And in elderly patients, 1 lakh international units every 3 months. While in pregnancy, 1 lakh international units from 6th or 7th month of pregnancy. Now, if we increase the dose of vitamin D, what happens? Hypervitaminosis D. Suppose if the concentration of the vitamin D in our body increases, so it can lead to renal calculi. Renal calculi means kidney stones, and loss of appetite, nausea, increased thirst, loss of weight. So this was all about vitamin D. And if you have any question relating this topic, ask in the comment section. And please subscribe my channel and press the bell button that you can get notifications of my upcoming lectures. Thank you.